A doctor with 4 board certifications and 27 years in medicine. And the most important thing she ever learned about health, she didn't learn in medical school. She learned it by accident, in her own body, at a point when she was too exhausted to even think about her health. I'm your host, Suzy Wraines, and you're listening to Health Over Wealth in the U.S., the podcast that helps Americans find cash-based, client-centered care outside the traditional insurance system. Today's episode is a short one. I wrote an article this week called "The Healthcare System Was Never Built to Keep You Well." It's about a physician named Dr. Tessa Damm and a video she posted about 3 moments in her career and her life that changed what she believed about health. I'm not going to read you the whole thing. I want you to go and read it. It's an amazing article. But I do want to tell you why it mattered enough to me to write about it. Dr. Damm spent her career inside conventional medicine, internal medicine residency, more than a decade in the ICU, and what she came to understand slowly is that the system she trained in was built to respond to disease, not to build health. She talks about 3 moments: a change in her own body during residency that her training hadn't prepared her to recognize, a decade in the ICU, watching the same preventable pattern show up again and again, and her mother's decline with Alzheimer's, which she came to understand was connected to the same metabolic dysfunction she'd been treating in the ICU the whole time. Here's what stuck with me most. She's not the only physician saying this. In the article, I connect her story to 4 practitioners already listed in the Centered Care Directory at healthoverwealth.us. An orthopedic surgeon in Pennsylvania who spent 21 years fixing breakdowns before she started asking how to prevent them. Nurse practitioners in Washington, Minnesota, and Idaho, each writing about a different piece of the same idea: insulin resistance, hormone health, the time it actually takes to practice this way, different specialties, different states, the same conclusion. This isn't one doctor's opinion. It's a pattern showing up across the medical community in different corners of the country, independently of each other. That's exactly why the Centered Care Directory exists, healthoverwealth.us, to help you find practitioners across the United States who are already practicing this way. Go check out the article. I go into detail more and share Dr. Damm's video that she did on YouTube, sharing her story and how it connects to the other 4 practitioners that I name here. If any part of this sounds familiar, if you felt like 15 minutes and a prescription pad was never actually enough, go read the full article. The healthcare system was never built to keep you well. Follow the show so you don't miss the next one. Health Over Wealth in the U.S. You have options.